54 million Americans wake up every day with joint pain that makes even simple tasks feel impossible. But here's what your doctor might not be telling you. The solution isn't always in a pill bottle. I'm talking about evidence-based, natural interventions that actually work, backed by the American College of Rheumatology and published scientific studies. And today, I'm going to walk you through the exact strategies that can reduce your joint pain without relying solely on medication. In this video, where we break down complex medical research into actionable steps you can start today. By the end of this video, you'll have a clear roadmap of natural therapies that can complement your current treatment, or in some cases, help you avoid medication altogether. So let's break this down. The movement paradox. Here's the thing most people get wrong about joint pain. They think rest is the answer. But the American College of Rheumatology issued a strong recommendation, their highest level for one intervention above all others: consistent exercise. I know what you're thinking. Exercise? When every step hurts? Stay with me. Think of your joints like a rusty door hinge. If you never open the door, the hinge gets stiffer and more painful. But if you start moving it regularly, slowly, at first the rust breaks away, and eventually, it moves smoothly again. That's exactly what happens in your body. Movement increases blood flow to your joints, delivers nutrients, flushes out inflammatory chemicals, and strengthens the muscles that support your joints. Without movement, you're stuck in a downward spiral. Pain leads to inactivity, which leads to stiffness, which leads to more pain. But here's the key. You need the right type of movement. The research shows 4 specific types work best, and I want you to pick the one that fits your current ability level. First, aquatic exercise. Water supports your body weight, reducing pressure on your joints by up to 70% while still providing resistance. A study showed improved physical function without increasing pain. Think swimming, water aerobics, or even just walking in a pool. Second, resistance training. Light weights or resistance bands strengthen the muscles around your joints, which act like shock absorbers. The evidence shows this improves both function and pain levels. Start light, even 2-pound weights can make a difference. Third, mind-body exercises like yoga or tai chi. These combine gentle movement with breathing and meditation. The research shows improved physical function and significant reductions in stress hormones that amplify pain perception. And fourth, just basic aerobic movement. Walking, cycling, even dancing if that's your thing. The goal is consistency, not intensity. 20 minutes, 3 times a week, is the minimum effective dose the research supports. Here's your action step. Choose one type of movement and commit to it for the next 2 weeks. Start with just 10 minutes if that's all you can manage. Moving regularly is the single most powerful natural intervention for joint pain, and if you're serious about managing pain naturally. With science-backed strategies, hit that subscribe button. I release new evidence-based health hacks every single week that can change how you feel in your body. The heat and cold protocol. Now let's talk about something you can do right now, today, that costs almost nothing. Thermal therapy. Your body responds to temperature the same way traffic responds to signals. Heat tells your blood vessels to open wide and let more traffic through. Cold tells them to narrow and slow everything down. Both have their place, and knowing when to use each is crucial. Here's the rule. Heat for stiffness, cold for inflammation. When you wake up and your joints feel tight and achy, that's stiffness. Heat increases blood flow, relaxes tight muscles, and helps ease that morning rigidity. A study on paraffin wax baths where you dip your hands in warm wax showed significant decreases in stiffness and pain, especially for hands and feet. You don't need fancy equipment. A heating pad, a warm bath with Epsom salts, even a warm towel wrapped around the painful joint for 15 to 20 minutes works. Dr. Diana Gurnita, a rheumatologist, notes that heat works because pain causes your muscles to contract protectively, and warmth breaks that cycle. But here's where people mess up. They use heat during a flare-up. When your joint is hot, red, and swollen, that's active inflammation. Adding more heat is like throwing gasoline on a fire. That's when you need cold therapy. Ice decreases blood flow, which reduces swelling. It numbs the nerve endings that transmit pain signals. A study on knee osteoarthritis showed that ice massage for 20 minutes, 5 days a week, produced clinically important improvements in function and strength. Use an ice pack wrapped in a thin towel for 15 to 20 minutes. Or try a menthol-based cream like BioFreeze, which creates a cooling sensation without the mess of ice. Here's your protocol. If it's stiff and achy, use heat before activity to loosen up. If it's swollen and inflamed, use cold after activity to bring down inflammation. And never apply heat or ice directly to bare skin. This simple temperature manipulation can reduce pain by 30 to 50% according to the research. It's not glamorous, but it works. The topical solution your doctor recommends. Let me tell you about something rheumatologists are increasingly prescribing as a first-line treatment: topical anti-inflammatories. Most people think of NSAIDs like ibuprofen as pills. But there's a better way: topical gels like diclofenac, which is the generic name for Voltaren. Here's why this matters. When you take an oral NSAID, it travels through your entire digestive system, gets absorbed into your bloodstream, and circulates through your whole body. That's why it can cause stomach ulcers, increase heart attack risk, and damage your kidneys. But topical NSAIDs? They penetrate the skin directly to the joint beneath. Minimal systemic absorption means you get pain relief where you need it without the dangerous side effects. Rheumatologists specifically recommend this for patients with a history of heart disease, gastrointestinal bleeding, or kidney issues, people who can't safely take oral NSAIDs. The American College of Rheumatology's guidelines from 2019 specifically support their use, particularly for small joints like the hands. Apply a thin layer to the painful joint, rub it in gently, and wash your hands afterward. You can use it up to 4 times a day. Most people feel relief within 30 to 60 minutes. And here's something most people don't know. Capsaicin cream made from chili peppers works through a completely different mechanism. It desensitizes the nerve receptors that process pain signals. A German study showed a nearly 50% decrease in joint pain after 3 weeks of consistent use. The catch with capsaicin is that it burns at first. That's actually how it works. It causes a mild irritation that eventually depletes the substance your nerves use to transmit pain signals. Use it consistently for 2 to 4 weeks before judging effectiveness. Between topical NSAIDs and capsaicin, you have 2 powerful, low-risk options that work through different pathways. And yes, you can use them together, one during the day, one at night. The anti-inflammatory food strategy. Now let's talk about what you're eating, because your diet is either feeding inflammation or fighting it. The American College of Rheumatology issued a conditional recommendation for one specific dietary pattern: the Mediterranean-style diet. Not paleo, not keto, not vegan, Mediterranean. Here's why. Inflammation in your joints is partly driven by inflammatory chemicals called cytokines circulating in your bloodstream. The Mediterranean diet is rich in foods that actively reduce these inflammatory markers. We're talking about fatty fish like salmon and sardines, which contain omega-3 fatty acids that block inflammatory pathways. A 2017 review of 20 studies on rheumatoid arthritis found that fish oil significantly reduced joint pain, stiffness, and the need for NSAIDs. We're talking about extra virgin olive oil, which contains a compound called oleocanthal that works similar to ibuprofen. Nuts, especially walnuts and almonds. Colorful vegetables loaded with antioxidants. And yes, even red wine in moderation. But here's what the research also shows. The ACR conditionally recommends against adding dietary supplements for arthritis management. Why? Because the evidence for supplements like glucosamine and chondroitin is controversial at best. They want you to get your nutrients from actual food, a food-first approach. That said, there are two supplements with decent evidence. Turmeric, specifically the active compound curcumin, has been shown in a 2016 review to reduce osteoarthritis pain as effectively as NSAIDs when taken at 1,000 mg per day for at least 90 days. You need to combine it with black pepper for absorption. And ginger from the same family as turmeric showed in a study that 1,500 mg daily for 12 weeks reduced inflammation markers, joint pain, and swelling in rheumatoid arthritis patients. Here's your action step. For the next week, add 2 servings of fatty fish, use olive oil as your primary fat, and eat a handful of nuts daily. That's the foundation. If you want to try turmeric or ginger, talk to your doctor first about the right dosage. Your diet should be medicine, not just fuel. The support tools that actually help. Let's talk about physical support braces, splints, and assistive devices. I know what you're thinking. That's for old people, or, I don't want to look disabled. But here's the reality. Stabilizing a painful joint reduces pain by offloading pressure and keeping the joint properly aligned. The American College of Rheumatology conditionally recommends splinting and bracing for hand, wrist, foot, ankle, or knee involvement. The evidence shows it can reduce pain and improve function, especially when prescribed and fitted properly by an occupational or physical therapist. Think of it like this. If you sprained your ankle, you wouldn't refuse crutches because of how they look. You'd use them to protect the injury while it heals. Joint braces work the same way. They give your inflamed joint a chance to calm down while still allowing you to function. Arthritis gloves provide gentle compression that reduces swelling and improves circulation. Thumb splints stabilize the base of your thumb, which is a common site of osteoarthritis from repetitive use. Knee sleeves provide support and warmth. You don't need to wear them 24/7. Use them strategically during activities that aggravate your pain or during flare-ups. And here's something the guidelines emphasize: joint protection techniques. This means learning how to move and perform tasks in ways that minimize stress on your joints. An occupational therapist can teach you how to open jars without straining your hands, how to lift objects using larger, stronger joints instead of smaller ones, how to organize your workspace to reduce repetitive strain. This isn't about limitation, it's about working smarter, not harder, so you can stay active longer. So here's what we covered. Movement is your most powerful tool. Choose one type and commit to consistency. Use heat for stiffness, cold for inflammation. Try topical anti-inflammatories before oral ones. Shift to a Mediterranean-style diet. And don't be afraid to use braces or support tools when you need them. The key insight from all of this research: joint pain management isn't about finding one magic solution. It's about building a toolkit of evidence-based strategies that work together. And here's what I want you to do right now. Pick one strategy from this video. Just one. Commit to it for 2 weeks and pay attention to how you feel. If this video gave you even one actionable insight, hit that like button so I know to make more content like this. And drop a comment telling me which strategy you're going to try first. I read every single one. You don't have to live with constant pain. You have more control than you think.